According to the World Health Organization and other scholarly literature, youth who smoke are significantly more likely to engage in the use of other harmful illicit substances, which in turn can cause them several detrimental short and long-term health consequences. This is especially true for those who come from marginalized communities such as the homeless or at-risk for homelessness communities. This issue is evident in inner-city regions globally, including that of downtown Ottawa. Here, you can see hundreds of people smoking cigarettes on the streets, and of course, many of these communities are hidden. This issue has been recognized as one that requires attention and intervention by United Way Ottawa. They have carefully selected our program for funding to tackle this preventable issue among youth between the ages of 12 to 17. This comprehensive program, PROMPT, which stands for Participatory Research in Ottawa, Management and Point of Care for Tobacco Dependence, is unlike standard smoking cessation programs in that it's not only curative but also preventative. It tackles several determinants of health, such as increased access to education and providing participants with positive social support networks. Additionally, it also empowers community members with lived experience to make a difference as peer researchers in the lives of those seeking support, as well as the opportunity to make a living wage from their work. The PROMPT intervention consists of free, off-label nicotine replacement therapy for participants, addictions counseling provided by experts, bi-monthly life workshops such as financial literacy and meditation, access to a safe and non-judgmental space in which to interact with their peer researchers for follow-up meetings on a monthly basis. Results of our 2016 feasibility study indicated a mean reduction of about 11 cigarettes among study participants, as well as a shockingly considerable reduction, and in some cases cessation, of self-reported illicit substance use. We also found that there was an increase in psychosocioeconomic benefits and social outcomes amongst our participants. Many of our participants made the decision to return to school, return to work, as well as make positive changes to their health behavior, such as eating healthier and engaging in physical exercise. This proposed study will be targeting at-risk youth and will follow the same mixed methods, community-based participatory action research approach as the feasibility study, which is now published in the open access peer-reviewed British Medical Journal. We will be collecting both qualitative and quantitative data using predetermined iPad-based questionnaires, which were also used in the feasibility study, to measure specific health and indicators for respiratory health, mental health, and quality of life. The primary quantitative indicator that we will be using to measure intervention success is the number of cigarettes and other illicit drug use being reduced or quit based on the monthly interviews, as well as the difference that we observed from baseline towards the end of the study. Other data that we will be assessing will be changes in physical health, such as lung function, mental health, such as depressive and anxiety symptoms, as well as quality of life. We will be using the patient health questionnaire, the GAD questionnaire, the EQ5D3L questionnaire for quality of life, as well as other pre-specified questionnaires which are already in our iPad-based surveys. The qualitative data that we will be collecting on a monthly basis will include uptake of the intervention, as well as facilitators or barriers that participants may have experienced with respect to the intervention. We have 4 members of our team currently. We have an executive director from our partner Operation Come Home, another executive director from another partner known as We the Parents. Both organizations are not-for-profits grounded in serving at-risk youth with their substance abuse needs, as well as improving their quality of life through both programming and advocacy. Dr. Smitha Pakal, who is also the executive director of our Ottawa-based Community Research Center, is the founder of this program, and she has recently been awarded 2 CIHR grants to scale this project to Toronto, and she has also been approached to scale this project internationally by international partners. We will also be recruiting 4 peer researchers in the next few months, training them and then having them collect the data for our study. With a $5,000 or $10,000 funding grant from Unite for Sight, we hope to engage more youth from alternate settings. This will not only increase the validity as our sample size increases, but it will also provide the necessary smoking cessation support for at-risk youth around downtown Ottawa for more at-risk youth. We will also use this funding to recruit more peer researchers and provide them with a fair and living wage. We are currently in the early implementation phase. We just received a $30,000 grant, of which $10,000 is allotted for project expenses. This intervention was developed in 2016 and is now in its scaling phase. Thank you.